Next week there's some big things on the calendar, including for our children 6 months to 4 years old. What do you think is going to happen next week, and then how soon could we really see shots for the youngest of our kids?
Right. So this is an exciting time for parents who have kids under the age of 5. Really, the last group that's been ineligible for vaccine just due to the lack of studies up until this point. Both Pfizer and Moderna have released their initial and really upfront data about the efficacy of their vaccines. Now, recall, Pfizer had released data about a 2-dose series several months ago, and due to the lack of efficacy, it decided appropriately to pull back. So the series now is a 3-dose series. I believe of 3 micrograms, which is a 1/10 the dose of the adult dose. And the early efficacy studies are really quite impressive. I believe it's in the mid-80s in terms of efficacy. The Moderna vaccine is a 2-dose series, I believe, of 5 micrograms and over 28 days. And at least the data regarding the neutralizing antibody response really is quite impressive. And now what remains to be seen is what happens with this new news today in terms of the booster. Will the next set of vaccines from Moderna as the primary series be more inclusive of the Omicron variants? I think that would be a very interesting piece of information to get from Moderna.
And I think the other big question is, are parents going to do this, right? Obviously, we're coming into summer. People want to go on vacations or send their kids to camp. But when you take a look at these numbers, they're really not that promising. Not all these parents are eager. Only 29% of the 5 to 11-year-olds right now are fully vaccinated against COVID, even though that group has been eligible since November. You've got the Kaiser Family Foundation. They reported just 18% of parents with children under 5 are saying that they would get their kid vaccinated right away. 38% of them saying they want to wait and see, and 27% saying definitely not going to get their child vaccinated.
Yeah, I think this is a really important struggle for many parents, right? I think that fortunately, right now, we're in a place where the numbers have slowly begun to dwindle down, where clearly the number of hospitalizations and people getting markedly sick, children or older people, from COVID has begun to dwindle. So I think there is some degree of fatigue related to the pandemic overall and related to the vaccines. I think that where parents have to have a conversation with their pediatricians or their family doctors is it's hard to look forward and see what the next variant will bring, right? And we do know that while thankfully most kids don't get very sick, COVID remains a serious interrupter to normal life, right? They are out of school for 5 to 7 days. Parents may have to stay home from work. So I think the health benefits, the public health benefits, the return to normalcy benefits probably are there. I have a child in this age group who's going to be vaccinated. Right, I'll put my money where my mouth is. I do think that one question for parents might be, do they time this a little later in the summer in anticipation of a likely surge in the fall where we see with other viruses as well?
Right, especially because in the summer months, you're most likely more outside. The air ventilation is different than when we kind of have to head indoors in the fall.
That's correct. And in addition, I think there have been, it's a very valid point to say that there have been, a large number of kids and the general population who have been either vaccinated or infected. So there is some degree of immunity. So the question is, how do you get the most bang for your buck? And that might mean holding off until a little later in the summer, certainly if you've had a recent infection, and probably timing this sometime in the late summer to be prepared for that likely fall surge.
All right, let's